Mio was asking me why it is I like to do this on my patients, and every physical exam should include a observation of the actual patient, the way they stand, the way that they move, range of motion examination, a neurological examination, palpation, actually putting the hands on the patient to feel through yourself, as well as orthopedic examination tests, which I include in most of my videos here. Not every patient condition necessarily warrants a full neurological examination, but I'm a huge fan of doing them on all of my patients regardless, just for screening purposes. That's kind of a personal thing with family history of neurological disorder. I like to be a screening person for potential neurological dysfunction.